कैमरा ऑन करो हां हां কি হল ক্যামেরা কি হল
কিন্তু তো আন্দাজে গেল ভাই চিন্তা এই
হ্যাঁ
কিছু ঘুরে দেখিও বাস
এটা বাদ দাও এটা লাইট দিব না
এই গেট তো আনবা লাগবে না
হ্যাঁ
এসিডি গেট তো অন আছে আমি না
এটা বাদ দিয়া এটা ইয়ার আইছে নাই
এটা হিতে
হবো না এটা আউটপুট পাইছা আউটপুট ক্যামেরাটো পাইছা
এবার পাই
হবো না এখন বাদ দিয়া डिस्प्ले 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 तो डिस्प्ले आई गो डिस्प्ले आपको बना এই ডিসপ্লে আউট एलसीडी से एलसीडी
এটা ব্রাইটনেস আছে BIKF নরমাল সেলফ গ্রুপ
এই আউটপুট চলা আউটপুট চলা ডিসপ্লে আউট
এলসিডি
এই
তোমার দিলে আপনার এই যে যাব এটা হয়ে যাব
হেটু লাগে এটা লাগে তাত না লাগে ওই না লাগে
এটা বন্ধ হয়ে যাবে
বন্ধ হইছে তো ওই গুছে না সা গুছে নাই তো
এটা না এরকম সেদিনকে এটা বের করে খাও এটা বলে
তুমি এইটো মানছ না তুমি আকৌ এই মাত্র ডিসপ্লে আউট কৰিছ
এইটো কৰিছ
बोल लगे
डायरेक्ट डिस्प्ले एरिया रा
कुछ नहीं पता এটা কার ক্যামেরা
এই আইডন দেখি
এইটো এই তুমি মাত্র যে ডিসপ্লে আউট আছে এটা হেতু কাটি দিছ
ডিসপ্লে আউট বলে যাচ্ছে
ডিসপ্লে এই আউটপুট সেটআপ এটা না আউটপুট সেটআপ ক্লিক করা এই এই মানে এলসি এটা ক্লিক করে তুমি এটা বসে থাকো এটা মানে কল করো বুঝছে নাই না কোনটা আছে বুঝছে না হ্যাঁ বুঝছে এটা কোন নাটা বসে থাকো এগুলো সব দিন করবে হ্যাঁ এটা স্ক্রিন কি বড় দেখাই দিব ইয়াত বড় দেখাই দিব এটো মানু আর স্ক্রিন দেখুন কভার করবে
আপনার ওয়েট কে লইলে পারো
ওয়েট দুজন আগে হ্যাঁ
আর এটা ফাফালি থেকে দিন ডাইরেক্ট
পুরা দিন করবে এফালে ইমান দরকার নেই আর দেখ ভাই পেলে বইয়ে শুরু করে দিই হ্যাঁ আর ভাত টাইমত খাই গেলে হ্যাঁ এটা কোন গালি দিলো
দেখি বিয়ার মকে নেব
এটা আর হিলাই নিব হ্যাঁ ঠিক আছে
তো ফেগো দেখি মাঝে মাঝে তুমি ল্যাপটপ অন করে দিবা কৈ দিব পাৰে বাৰু অকণমান
এইটো এতিয়া চাই লওক কিন্তু নহ'ব এইটো মানে
এইটো অলপ কমাব নোৱাৰিব এইটো
চফ্টৱেৰ কৰিব লাগে হা এইটো চফ্টৱেৰ মাৰিব
এইটো ৰাখি দিয়ক এইটো ৰাখি দিয়ক
হৈ যাব ঠিক
এই বাটটো যদি এইটো ৰাখি দিয়ক Hello. 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 Test. Mic test. Hello. Hello. Hello, mic test. Hello. 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 Hello.
हाँ 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 check no
Very good morning to all present. Warm welcome to Boylan International Knowledge Festival. Uh, we have all gathered here for the session, the first session on behavior change. This session is a paper presentation session where we have 5 paper presenters. Uh, we will have with us during this session Mr. Bhaskar Bhuya, who is the founder, Brahmaputra Foundation and Station Manager at Brahmaputra. Mr. Manjeet Musari, Assistant Professor, Assam Don Bosco University. Mr. Prasenjit Das, who is the State Lead, Karnataka Health Promotion Trust, Assam, followed by 2 paper presenters who have contributed research papers on this theme. So I extend warm welcome to all of you and all the dignitaries present here to this particular session on behavioral change, which is part of the Bollywood International Knowledge Festival. I'll request the first speaker, Mr. Manjeet Musari, to please come forward and share his deliberation, his experiences of working in the field to initiate social and behavioral changes in Assam.
Thank you so much, Professor Landry, for giving me this opportunity to come and present something that we have been doing in the 4 districts of BTC region on social and behavioral change. Giving India first Borderland International Knowledge Festival organizer, Borderland University, that is a BTC circle. They worked at the name and then first time such a mega event has been conducted. I feel so honored to be part of this event, and I congratulate the organizer for making this event a very, very successful one. And also giving us a lot of platform opportunities to learn and gain experiences from different speakers, but from outside of India. It is indeed a moment for us to learn as well as look forward how we can think of addressing some of the problems that we have. Ang name mo Monty Musari, ang Don Bosco University Communication Department faculty. Using like I say, UNICEF collaboration in collaboration with UNICEF India country office as well as Guwahati office. We started a very unique initiative which is called Notice Social and Behaviour Change Alliance. This is an effort which is supported by UNICEF to intervene in the field of social and behavioral change on SBC priority. The BTC in Northeast 7 states are development challenge. Whether it is health, education, nutrition, wash, gender, child trafficking, human rights violations, by the intervention, notice social and behavioral change for the right. So the idea is to intervene in area which is so much concerning for us, such as gender violence, child trafficking, human trafficking, education, malnutrition, and there are many genuine issues in the northeastern part. Particularly, also we are focusing the 4 districts of BTR, just to intervene in the field of how social and behavioral can change or transform this region. Overall, how to contribute in the field of social transformation. So this is one initiative which is supported by UNICEF India Country Office, as well as different stakeholders who have become part and parcel of this initiative. So, here in paper presentation, this is a reflection of what we are doing in the field. The types of work we are engaging with the communities or the stakeholders in the northeastern region. So it is my apology. So I'm not purely focusing on the academic, but rather on the practices or the intervention works which we are doing in different parts of the northeast. So today we'll have 2 sessions. I will be talking about some of the intervention work that we have done in the BTC region. In the second panel discussions, my project sponsor with UNICEF. One of the speakers will be talking more about social and behavioral change in the Northeast. So my limitation is I will be focusing on some of the activities which we are doing in the BTC region. As I said in the beginning, this is a secretariat which we have set up at Don Bosco University with the support of the UNICEF, which is located at Solapur, Guwahati. So in 2019, we had a very humble beginning. We had a national conference for 3 days held at Don Bosco University. The members of the stakeholders, universities from across the Northeast as well as from different parts of the country, we had started this initiative with a small pledge. This is to tune our work as well as streamline our intervention areas. So some of the priorities that we are looking at through this intervention, which is Northeast social and behavioral change society, is to ensure some kind of academic learning, both at the undergraduate as well as the postgraduate level, on social and behavioral change. Earlier, previously, it was focused on communication for development. Now, because of redefinition of the process and the way the community needs to be engaged, we are calling it a social and behavioral change. So, we want to capacitate for the teachers as well as the students in the field of social and behavioral change. And UNICEF has come out with a very interesting package, which is the provision for academicians and students to engage in different sphere of learning. So they have introduced 9 modules on social and behavioral change communication. Now it is shortly said social and behavioral change. So that is one component. And also facilitate some kind of academic engagement as well as impart capacity training to faculty members and students. So we have started capacity building training for academicians, more in the context of training the teachers on how to conduct SBCC programs, as well as how to impart the education in this huge area which is quite often unexplored. Then we have, of course, this is not a very organized network, but it's rather a collaborative initiative. It is nothing to do with the MOE signing with stakeholders, but it is a voluntary participation for members of the stakeholders who want to be part of this collaboration to gain as well as contribute something in the sphere of social and behavioral change. As well as we are collaborating with state government as well as with some departments. And we are also working close collaboration with Borderland Territorial Council to work in the areas which is of priority in the region. Like for example, in the BGC regions, there are so many genuine socio-economic issues. Like we have seen several types of conflict in the past, and trust building, peace and conflict situation is still fragile. So we want to strengthen trust building, which is also a priority, and as well as in areas of education, child trafficking, and many other issues. And also facilitate learning from some of the important socio-cultural practices in the region. Like every culture has something to contribute, and every culture has some best practices. So we want to exchange this interesting social practices with members of the stakeholder, so that we learn from each other as well as how our social enabling environment can be potential in achieving social transformation. And also, we have engagement for the students, that is to ensure some kind of mandatory learning in the field of social and behavioral change. This is the present status of the alliance, which we have started in 2019. Central and state universities in different parts of the Northeast. 13 more institutions will be launching a C40 curriculum on next month. We have a 3 days workshop, which is scheduled for March. And more universities have actually come forward to introduce some kind of course which is very much relevant in their local context. Then we have a collaboration with social CSO. There are 84 institutions, 84 civil society organizations, NGOs, and foundations from across the northeastern states. Then we have another interesting engagement with faith-based organizations. Like I said, the organizations. So we are also collaborating with religious institutions. This is to facilitate some kind of to have a more outreach to the communities. So we have a number of religious organizations. As of now, it is 25. So they have been part and parcel of our initiative since 2019. Then in the 4 districts of BTR also have an interesting project. So you guys know about. That is, we have trained in the last 1.5 months now. We have trained 100 BTR volunteers. We are working with BTR volunteers. The idea of grooming or forming volunteers is not to seek for their kind of voluntary services, but rather to create human resources. Jingni society of human resource kanako. Jai area mane kamani intervention kamna aya. By context of the mane makase volunteers lana training and capacity building come there. So the idea is we create human resources at different levels of society so that they are always there. Whether the project is running or not, that's a secondary point. But at least somebody who is really competent enough to and further engage with the communities on issues of priority. Take for example, gender violence, human trafficking, education, school dropout, health, lifelong harmony happen. We need to BTC 100 volunteers training come there. That's the first phase of the next phase is happening from March 2023. Next. This is what we basically we are a small team, but we have more collaborations from institutions and organizations. So the alliance is headed by Dr. Riju Sharma, and she will be attending a panel discussion tomorrow. She is the head of the alliance. Then we have 2 faculty members, including me, and also we have 4 project staffs. 2 for the BGC region and 2 for the northeastern states. So this is an overview of what we are doing since 2019. So we began with the National Conference on Social and Behaviour since 2019. Then we initially started with a small introduction of course at Don Bosco University, both for PUG and UG level. So during the conference, we modules which can be imparted all of the curriculums. That was in 2019. Then during the COVID, we started another interesting project which is called social mobilization on COVID appropriate behavior, risk communication and community engagement. So that we started in 20. In March 2023, we are strengthening this network with incorporation of 13 more universities, both central and as well as state universities, to introduce some kind of learning curriculum for both PG and UG students, as well as to facilitate for some kind of research work in the field of social and behavioral change. This is the project which we started in 2021. It is for 1.5 years. First project. Risk communication and community engagement. CBOs as well as faith-based organizations. And focusing on 4 districts of BGR as well as northeastern states. So the goal was to enhance the capacity of different stakeholders for risk communication and community engagement. That is goal number 1. The second, facilitate dedicated influencers and foster sustained community engagement. Then nurture and propagate RCC and SBC through institutional strengthening. That is giving more opportunities for the institutions to engage in the community intervention work. Also support and facilitate promotion of COVID-19 vaccine. As you are aware, there are many places where vaccination was very low. But so we identify some of the priority areas so that people get vaccinated and stay protected. So this was also one priority. Then another project which is coming is from March 2023. So we'll be conducting several capacity building training programs, and also we'll be working with Portland Territorial Council. So BGC has almost about 100 development fellows. BGC on 100 development fellows to the next level of training of them. This will start very shortly, within a matter of 2-3 months. So that is one. And also we'll be working with the women collectives like SRLM, SCGs, self-help groups. So next, another priority is to work with women groups in 4 districts of PTR. Then in the Udalguri districts, we'll be, at least for a couple of months, we'll be purely focusing on child marriage as well as on education. Udalguri being the aspirational district, there are a lot of scope for intervention. So Udalguri is also a priority for intervention in the field of child marriage as well as education. Then also we have a series of training for the government officials as well as for the academicians. And more in the context of for the government officials, we'll be giving training to project implementation staff of various government departments. This is a reflection of who are the BGR volunteers. So basically, we have this is the percentage of representation when it comes to the volunteers. Individuals who are willing to be part of this collaborations, we have 37% of the total volunteers. CSO constitute 30%, and also we have faith-based organizations. In terms of gender representation, please go back to the previous slide. 42% from male, and 57% is male, 43 is female participants. We wanted more women representation. Definitely, that is likely to happen in the coming days, because this is also an opportunity to gender stream. This is a training which we conducted since 2021 to 2022. Yes. So we have, because of COVID-19, we could not conduct certain programs offline. So we have got a hybrid methodology of training, both online and offline. For the online, we have a series of programs, which we had 20 numbers of events for the volunteers. Then also we have offline training, which happened in Compressor and Baksa district, that is for training of the volunteers. Then we have community-led initiatives, which is supported by BIKF volunteers. So we wanted the members of the volunteers, as well as the key stakeholders to further strengthen our social mobilization. So 144 programs were conducted in different parts of the northeastern states, as well as in the BTR. These were the priority areas in which we were engaged in the community intervention. The first one is, of course, COVID-19 and also COVID-appropriate behavior. Nutrition and protein immunizations, the mother and child, and other important SDCC priorities. So in the last 1 year, this is the number of people we have reached through series of community engagement program. This is in the context of BTC, but for the northeasterns we have different numbers, of course, which another speaker will be presenting a little later. So another interesting initiative which we did as part of the collaboration with UNICEF is not only engaging in community activities or social mobilization works or intervention. So we wanted to contribute something for the community so that they themselves gain some knowledge. As you are aware, the literacy rate is quite low in the 4 districts of BTR. And more in the context of social and behavior, we see still some traditional practices being very much prevalent when it comes to certain social issues. Take, for example, when it comes to health, we still prefer to go for like seek some kind of healing touch from the traditional healer. This is one tendency that is required as well in this region. So this is our part of our initiative, which is to produce more knowledge, as well as scientific knowledge, as well as to promote some social practices, which are extremely important for educating the masses through community practices. Also to document some of the community practices which are very, very important for community intervention and social mobilization. Training and society of Zamani when self-learning materials form. Particularly in the local language, local communities knowledge product it's a riser as a because the publication is already available. So paper for the large scale of distribution. The idea is to be a large scale of distribution of knowledge product, which is going to contribute somewhere or the other for social transformation in the long run. This is a few example of the outcome of our work. This is not very exhaustive. Of course, we have many stories. The first one is about the child marriage. Social issues in the BTC, the child marriage is like different organizations are making this effort to deal with this situation. But this is one practical outcome of a little initiative when it comes to fighting child marriage. The program also board will lockdown working time short come negative, next session. So what will be working in the communities? This is our priority. The first, of course, we'll be working in the areas which is very much a concern in the northeastern states as well as in the 4 districts of BTR. We'll be more closely working in the field of child health, nutrition Mental health, as you are aware, this region has been in conflict for the last 30 years, and we have so much of internal as well as external disturbances. So this is one area. This is promote mental health as well as peace and tranquility. Also, we have a problem of substance abuse. Sandesh and Ishika also Sasiman Sarvumana, why don't you do something about substance abuse in one of the areas in Kokrasa district? It seems they have witnessed large scale problem with substance abuse. So this is also one genuine problem. There is जो शेरेपन by the company so was teaching drugs and by the company problem as in PTC or Parigas and more in the context of the cheap alcohol which is available from neighboring country, which is also contributing in terms of large-scale consumption of substance abuse. If you compare with Bhutan, we have very easy free access to practically very cheaper alcohol. So this is one, it has become a problem in certain bordering districts. Then second focus area, which is to strengthen more community intervention works, we'll be conducting more programs in areas where there are some intervention is absolutely necessary. Then the last is networking and strengthening our network. As I said in the beginning, 13 more universities will be joining this collaboration. They will be introducing more opportunities for those who want to pursue some sort of education and social and behavioral change. I will not speak for long. This is what we have done, and I'll just show you some of the activities, events that we have conducted. This is mainly for the student leaders as well as faith organizations and from across Northeast as well as from 4 districts of BIKF. This was with CIT for the BIKF volunteers. Thank you so much. If you have any query, you can feel free to ask. We will switch over to another speaker. Okay. We, of course, we are opting for those who are veterans and those who are not having any education, but they have social experience. That is dealing with the communities and working for the communities. And for the women as well as the social workers who don't have education, we don't put any benchmark as long as they're able to contribute in the social mobilization. In terms of community intervention, yes, there were some areas where we have people themselves took out the initiative, and we just when there was a trainer, so as well as social mobilization. So there are examples where people actually willingly come forward to be part of this initiative. So we are actually basically providing training on areas which are very important in this region, particularly for the BIKF volunteers. And of course, it is both offline and online, so we have to constantly update with training, which is very important. So that is one area where we are looking at. It is to constantly upgrade ourselves with knowledge and skills. So it is not just specific training that we are providing, but there must be some areas that is important for us. Now for Singnoram last in the next session of this. Do you have any in mind?
audible? Am I audible?
Yeah, yeah, audible.
All right. I don't know whether it's a question, so I'm just posing it. It was about in 2008. It was in this kind of a seminar. I was present there. So I posed this issue of the coming in, danger of coming in of drugs and the substance abuse. People laughed at me at that point of time. Uh, because we are from community, so we know what are the practices that prevail in terms of use of substance. And besides that, in the earlier days, there used to be some kind of a check within the community, but today there is a free run and availability of all the resources and the materials for the people. So in this context, how do we go about, tackling this issue? I am really clueless about it, at this moment. I think one of the best way is using this method of social behavioral change or the communications. That's the best method that we could do. But how aggressively are you planning to, ramp up this effort? That's what my request is for Don Bosco University.
Okay, thank you so much for the observation as well as the reflection that we all of us need to think about. Yes, we had in the previous decades, we have seen communities coming together and fighting against this substance abuse. We had, if you know, in the context of All Citizens Union, Borough Women Welfare Federation, they all were part of this movement against substance abuse. But in the long course of struggle against this substance abuse, I think the continuity of efforts somewhere it got lapsed. I suppose this is what I personally feel. Because we need to continuously work on this area. There is no permanent solution. And changing somebody's behavior, it's not a easy task. And today you might be able to convince somebody, the next day you may find the same person behaving the same manner, which was the life practice, I should say. So, in this context, I will give you one example. I came from a very remote village, which is just 30 kilometers from the international border. We had this problem of substance abuse in the entire village. So, of course, it has been a problem not only in the communities as well as in the family. Like a lot of disturbances in the family, you get to hear a lot of shouting and fighting because somebody happens to get overdrank alcohol. This was the problem. But there was a moment when the communities actually came together. The members of the village council they came together. They took a decision. No, we will not allow anymore substance abuse in the community events. Individually, if you have a drinking habit outside, we cannot stop it. Okay, there is no mechanism to 100% stop it. But in the communities, when it comes to social gathering, social events, we will not entertain anyone. So rather we put some kind of a penalty. If you happen to behave in this manner, you have to bear this kind of penalty. So this was one experiment, and today I find it is a little effective when it comes to dealing with substance abuse. So somewhere it's not rather individuals going and conducting a community events, motivating certain groups of people or individuals, but it is I think everyone that we should be part of this realization that it is not just one person's work, rather it should be a community-led initiative. And also we want this message to deliver to everybody. It is not we who are going to be there, it is the members of the community who needs to be seriously thinking about this problem. So in the context of this collaboration with UNICEF, the idea of having 100 volunteers was only for this region. Then we capacitate 100 volunteers, 100 members of the community from different communities from 4 districts. They get some insight and knowledge as well as learn how to do some kind of community intervention on issues of priority, whether it's about child trafficking, human rights violation, or it's about alcohol or substance abuse, that they are capacitated to the action so that they can do some kind of community intervention work. So this is one idea and which want to strengthen in the coming days. So I think this kind of initiative needs support of everybody, not only of NGOs coming together and working, but rather we need to take along every member of the community who wants to be part of this collaboration. We need everyone's effort, and it is in this directions that we are trying to work, and of course, as well as learning at the same time to more actively engage in this field. I hope I have addressed my concerns. And there is one genuine concern like Jew sunrise a culture, somebody will like to say winemaking is an art. It is also there are like concerns that only we need to change our lifestyle, the way you consume alcohol. So as long as this is treated as a culture, and fighting against culture is like you're fighting another enemy. So this is also a perception. Wine making as an art, some people will agree, and some would say wine production is also a culture. I think this is where we need to find some kind of new discourse, as well as to put some kind of barrier. I think it is where we need to think about it. Now, for the single mountain. Gilala ang kasi ang session ka जोंहा सासे बिराद interesting speaker दङ जों लोगोसे for the next session जोंहा गुबुन speaker दङ बर्षा चन्द्र बेजों लोगोसे जोंहा साउथ आफ्रिकानि speaker दङ बेजों लोगोसे जोंहा हाइटियाव social intervention खामानि मावनाय दङ so we'll be listening more about social interventions in the next session. So once again, thank you so much, and it's nice to see such a huge gathering. And of course, I must be grateful to the organizer for giving us this opportunity to come and share something that we are doing as well as learning from the field. Thank you so much. Thank you, everybody. Have a good day.
Thank you, Mr. Manjit Musari, for your insightful talk on the initiatives at your institution to bring about social change. Our next speaker is Mr. Prasanjit Das, who is the state lead for Karnataka Health Promotion Trust, Assam, to deliberate on his topic of discussion related to health safety, right? So I request sir to please come to the stage and deliver your session.
Namaskar. Khulunbai and greetings of the day. I thank my stars and on behalf of my organization, the KHPT, I would also like to thank all of you, the Boreland University and the BTR government for actually offering us this proud privilege of being with you. All of your august presence has really made my day. Respected guests, generally a seed of thought gets translated into a mass movement, and we have seen this. This very event is an example, like someone might have thought about this noble idea of having an event, an education, a cultural fest, and now this is what we are experiencing. So what happens in most of these cases, and a determinant, a factor which is invisibly visible, is behavior change. And I take this opportunity with all humility and responsibility to share our recent experience with behavior change. We generally work with the community. We are public health professionals. So, and we are primarily working in the field of tuberculosis, TB. But before that, just to break the monotony, all of us, we can do a scoring. I think I entered the gate and I saw this kind of beautiful arrangement, like, the students engaged, the faculty members engaged, the whole university as a system, as a mechanism, like, wholeheartedly, like, involved in this mega event, the stakeholders, the government, everyone. We also see delegates coming from abroad, some other parts of India. So all of the people have collectively, like, contributed towards the good conduct of this event. So let us have a scoring done. अब scoring जब करना होता है तो we have to give some marks. So we cannot give marks here. So what we will do? We will score with claps. 1 mark is equal to 1 clap. সকলে বুঝি পাইছে না? এটা mark মানে এটা clap. The maximum mark is 15. The maximum score is 15. So I will ask at the count of 3. At the count of 3, আপোনালোক সকলোৱে স্কোৰ কৰিব লাগিব maximum 15 হয় তাৰমানে কাৰোবাৰ যদি বহুত ভাল লাগিছে 15টা ক্ল্যাপ আমি দিব লাগিব জোৰে to the for this effort by the organizers. So at the count of 3 we will clap. The maximum clap is 15 and that is our scoring. Can we begin? 1 2 3. I wanted more scoring from everyone. Once again, 1 2 3. I counted someone also scored 20, so that's okay. That's okay. Yeah. So thank you so very much. We are from, as I say, from the KHPT, and we work basically with the communities. We are spread across India, but primarily breaking the barrier is an effort where, like, we try to find out those impediments, those roadblocks, which are actually resisting the people, mostly from the vulnerable sections, to go to the health facilities and get treated. Next one. So, let me give you a context. Amit, TB kotha कहूं, when we talk about TB, tuberculosis, आप सभी के लिए बहुत लोग आप में से जानते होंगे टीबी क्या है, लेकिन कुछ ऐसे भी होंगे जो कि नहीं जानते होंगे. Just to introduce TB to all of you, tuberculosis is caused by Mycobacteria tuberculosis, or it is statistically proved that 1/3 of humanity has the TB infection. The infection hasn't turned into a disease because that depends upon, like, the immunity, the immune system of a person's body. Now, the whole world has taken cognizance of this, and the countries all over the world, they say that by 2030 we have to eliminate TB from the world. TB has been since long years, like, it's maybe 2000, 3000, 5000 years since humanity. TB हमारे बीच में है और अगले 5-10 सालों में हमको TB खत्म करने हैं, और the government of India has taken this ambitious target of eliminating TB by 2025. So the other context is India is contributing to more than 27% of the global TB burden. So इसमें आपके जनरल टीबी होते हैं और इसमें जो आपके ड्रग सेंसिटिव टीबी हम बोलते हैं और एक ड्रग रेजिस्टेंट टीबी होते हैं. So India also has the largest number of drug resistant TB in the world. Now this is one part of the story. The other is generally when we talk about the common people, जब हम आम आदमी की बात करते हैं तो अमूमन ये होता है कि कुछ अगर हमारी बीमारियां होती है, then we will like to take self treatment. हम कभी ओझा के पास जाएंगे अगर गांव में है, तो कभी किसी और के पास जाएंगे, and अगर शहर में भी है तो we will try to have some over the counter drugs, self treatment, and the medical officer or the facility would be our last resort. So there is a strong urgency to call for positive health seeking behavior. আৰু এই যে আমি ব্যৱহাৰিক পৰিৱৰ্তনৰ কথা কৈছো, ব্যৱহাৰিক পৰিৱৰ্তন হলেহে আমাৰ এই জন আন্দোলন বিলাক যি হয়, এই জন আন্দোলন বিলাকৰ আৰু এটা ডাঙৰ ৰূপ, এটা চিৰস্থায়ী আমি ৰূপ দিব পাৰো. আমাৰ সমাজৰ পৰা আমি এই ধৰণৰ প্ৰত্যাহ্বান বিলাক, এই ধৰণৰ ব্যাধি বিলাক আমি গুচাব পাৰে। So what you see here, as we say, like, we work mostly across three districts of Assam. BTR ami Baksat kaam kori asu. We are working more with the tribal population here. In the district of Dibrugarh, we are working with the tea garden population, and in Kamru Metro, we are working with the urban vulnerable. Of course, like, very recently we have also taken up Sonitpur as the fourth district, where we are again working with the tea garden population, especially the temporary tea garden workers. They call themselves as non-workers. So, this is all about breaking the barrier. It is more about creating like a behavior change solutions. These are the triggers. These are the engines जो actually induce करे व्यवहारिक परिवर्तन. Like, they actually positively influence a person or a community to take up positive behavior. So how do these help us? They help us in case notification. They also help us cover TB as that treatment adherence has to be improved so that, like, the treatment outcome is very, very good. Because TB is an airborne disease, this can relapse. If I get casual, if I don't take my medicines properly, again this will come. And this is a long-term disease. মোৰ যদি কাৰোবাৰ যদি টিবি হৈছে কমসে কম 6 মাহ ঔষধ খাবই লাগিব. So that is why behavioral change matters a lot. So this is like, the country landscape where we are working. Next one. So this is the behavior change operation models which our organization basically has developed, and we share this with the stakeholders, the government. But prior to that, we pilot this in the communities, and we ensure that, like, initially we will do this with the community, but over a period of time, the same things should be evaluated and be done by the communities. So, these are our outcomes. Next one, please. So it is very important to understand, like, what is behavior change. একদম সংক্ষিপ্ত যদি কব যাও, আমাৰ এই লৰাটোৰে কথা কৈছো, বাচ্চাটোৰ কথা কৈছো, ভালকে নপঢ়ে, পঢ়িব হলে পঢ়ুৱাব লাগে. So from this undesired behavior to the desired behavior, এইখিনি কৰিব হলে আমি যোনখিনি কাম কৰো, তবে ये होता है कि मेरा बच्चा बहुत अच्छा है लेकिन वो कभी खेलने को नहीं जाता है, और I want कि वो physically भी fit रहे. For this to happen, I undertake some interventions. I undertake some actions. Those actually manifest to behavior change of that kid. So similarly, anything like, which will take us from a non-desired behavior to the desired behavior is basically the behavior change. And this is the process which we actually take up. We generally adopt a socio-behavioral model. So it is not the clinical model. हम जाते हैं टेस्ट करते हैं वो नहीं है. It's mostly like, a socio-cultural behavioral model जिसमें हमारे जो co-partners होते हैं वो communities होते हैं. এই villager গৰাকী হয়, এই টাউনত থকা মানুহ গৰাকী হয়, এই বয়োজ্যেষ্ঠ মানুহ গৰাকী হয়, এই সৰু স্কুলত পঢ়া ল'ৰা বা ছোৱালীজনী হয়, এই মাতৃ গৰাকী হয়. So এই ধৰণৰ representatives বিলাক আমাৰ co-partners হৈ কিনে আমি এইখিনি কৰো. And this is all about engaging the community, mostly the vulnerable communities. কাৰণ কিয় যোনখিনি নিম্নবিত্ত বা যাৰ বহুত marginalized communities হয় তেওঁলোকৰ এই প্ৰত্যাহ্বানবিলাক বেছি ডাঙৰ হৈ যায়. So this has contributed directly towards active case detection, more detection of presumptive cases, more testing, more notifications. আৰু it is very, very important. COVID হৈ যোৱাৰ পিছত কি হ'ল, আজি যদি মই ষ্টেটিষ্টিক কওঁ, আমাৰ দেশত প্ৰায় 27 লাখ টিবিৰ পেশেন্টস আছে, আৰু অসমত প্ৰায় 50,000 2022 চনত টিবিৰ পেশেন্টস ডিটেক্ট হৈছে. But actually as per target it was 61,000. So 10-11,000 TB patients are missing. So similarly during the COVID era, what happened, 1 million cases got missed. So it is not only about, like, detecting the presumptive cases, it is also like, tracing the lost million cases. So this is where, like, the government of India, the Ministry of Health Family Welfare, the Central TB Division, the National TB Elimination Program, all across the states, and we partners and the community, we are all working towards, like, identifying these cases and, like, bringing the notification, the prevalence rate down. So এই ধৰণৰ আমি কিছুমান activities কৰো. Creating awareness, stigma, বৈষম্যতাটো এটা বহুত ডাঙৰ ফ্যাক্টৰ হয়. So whenever still we believe TB eta kusora rog hoy. So anyone who is afflicted with TB sometimes or on many occasions they are stigmatized. They are labeled. So hey bostu hoy. So the community what they do, তেওঁলোকে awareness create কৰে, sensitize কৰে আৰু তেওঁলোকে stigma reduction বহুত help কৰে. Gender disparity আছে, মতা মানুহ গৰাকী আৰু মহিলা গৰাকী আছে, কেতিয়াবা কি হয় আচ্ছা ছোৱালীজনী হ'ব বাৰু ল'ৰাজনৰ অলপ চাও এতিয়াও আমাৰ সমাজত আছে এইটো, this is still very prevalent, and sometimes the woman will herself do self discrimination. মই ঔষধ নাখাও দে, মই এনে ঠিক হম, গৰম পানী খাম অলপ, ঘৰতে কিছুমান উপচাৰ লম, মই নিজে ঠিক হম. So all this is actually leading to more cases of TB coming, and we also could find there is some kind of scope for gender integration and gender balance. ঠিক তেনেকৈ health seeking behavior যোনটো কলো নহয়, ডাঙৰ ফেসিলিটিজ আছে, ধুনীয়া হস্পিটাল হৈছে, তাৰে ডক্টৰছ আছে, নাৰ্ছেছ আছে, কিন্তু যদি কমিউনিটিৰ পৰা বেস অফ দ্য পিৰামিড, if the demand is not generated from the base of the pyramid, মানুহে যদি নাযায় তো স্বাস্থ্য কেন্দ্ৰটো একো লাভ নাই. আয়ুষ্মান ভাৰতে কৈছে কি আমাৰ 1.5 লাখ সাব সেন্টার্স কিনি হেলথ এন্ড ওয়েলনেস সেন্টার্স কৰিছে, তাতে মানুহ যাব লাগিব. So the effort is all about developing the health seeking behavior of the community, and it's also about supporting the persons with TB and their families. যেতিয়া কোনোবা এগৰাকী টিবি হয়, তেওঁ কি ধৰণৰ আমি কেয়াৰ আমি দিব পাৰো, তেওঁ কি ধৰণৰ ওয়েলফেয়াৰ কৰাব পাৰো, তেওঁ কি ধৰণৰ আমি গভৰ্ণমেন্ট যোনখিনি ফেসিলিটিজ আছে, যোনখিনি সাপোৰ্ট আছে, সেইখিনি তেওঁলোকক দিয়াব পাৰো, তাৰ বাবে সকলো কমিউনিটিয়ে যত্নপৰ হয়. মই যদি এটা এক্সাম্পল দিওঁ, বাক্সাৰ মুছলপুৰৰ VCDC, the VCDC chairman of Mushalpur, Baksa, he on knowing that this person is from a poor family and he doesn't have even a house, and he checked, he did some extra effort and he could find his name is enlisted in the names of all the beneficiaries, and he did some extra work, some hard work, and he ensured that the man, the family gets a house. Not only that, he also ensured the family also gets a ration card. So this is the kind of things which are being done. The non-medical supports are also being offered by the community. Advocacy and networking. Advocacy and networking খুব ভাল হৈ আছে. Recently, New Delhi, there was a national workshop on community health to combat TB, and I take it as a matter of pride to share with you, 2 gentlemen from Baksa, from BTR, they were nominated to go and share their experience. One was a VCDC chairperson, the same person whom I was referring to some time back, and the other one was a TB champion. So they could actually win a lot of applause and laurels from the participants from the national capital, and this happened only 4 days back. So this is how they are indulged in advocacy and sensitization. Next one, please. So here the our photo bilak dekhile, those are photos from the fields jor amar mohila hokol amar community manukhini goi pine teoloke bibhinno dhoroner kaam korise. The community jetia kaam korim bibhinno borgor manu thakibo, so IEC materials are very important. So amar keitaman IEC material ase, these are 1-minute videos on stigma. So I will like to take you through these videos.
Paling surprise di mana? তোমাক বৰকৈ মিছ কৰি আছে আৰু ময়ো টিভিৰ মতো আগ কৰি ধৰে পৰা নাছিল। যদিহে থাকে আপোনজনৰ হাত, টিভিৰ হ'ব নিশ্চিত নিৰ্বাণ। ভেদভাৱ নকৰিব, টিভিৰ চিকিৎসাত আপোনজনক সহায় কৰিব। हेलो सर, सर वही असिस्टेंट मैनेजर नि पोस्टखौ आं लेनो हाया। असिस्टेंट मैनेजर आक्रमा थ' दंखायो बे खामानियाव। आरे माबायदि बाथ्रा बुंदों सार सारा प्रमाथ टिभिनि फाहामथाय सोलिगासिनो दंमोन ना बेखौ फिन नोंथाङा खामानियाव माबोरै लाबोगोन टिभिनि फाहामथाय सोलिगासिनो जेब्ला इनफेक्सननि गिनांगौ मानो दं आरे प्रम माबायदि दङ मोजाङानो सार लिसन डन्ट वरी ना नों जेब्ला आबुङै मोजां जागोन अब्ला खामानियाव फैब्लानो जाबाय नों मोजाङै जादों लोंदों ना जानाय लोंनाया गोनांथार sit down लैला दावदै ओंख्रि लाबोदों आरे जा दावदैनि ओंख्रि सार बेथ' आंनिबो फेभरेट हरदो ना गोनांथि आंगोफोरनि गोहो टिभिखौ फोजोबदो मानोथो माइगाब जुजाय खालामदो टिभिनि फाहामथायाव आंगोनो हेफाजाब हो
সিদ্ধার্থকে লগ ধরতে নাই যাবি নাই যাব আরে কেন নাই যাবি এতদিন পিছিয়ে উইয়াকে লগ পাবি আরে ওয়ালাকে আমাকে দেখলে মানুষগুলা কি ভাববে ওর টিভি হচ্ছে মঞ্জু শারদা টিভি বেমারটা চিকিৎসা করলেই ভালো হয়ে যাবে কিন্তু আমাদের মাঝে মরমের বন্ধন একবার ভাঙি গেলে জোড়া লাগাটা বড় কঠিন এইরকম সময়ে তোকে খুবই প্রয়োজন বুঝলি
নিজের মানুষ থাকলে সঙ্গে দিদির হবে কেউ ভেদাভেদ কখনো
So, thank you. These are some of our intervention strategies. Ami ki koru? Pratham goi kine we identify the community structures. We have our processes, and after that we sensitize and empower. Kya unke keneke koribo lage? We make them undergo through those capacity build up stages and levels. And after that we find these community structures. Community structure বুলি যেতিয়া কম SHGs হ'ব পাৰে আপোনাৰ unions হ'ব পাৰে VHSNCs হ'ব পাৰে চহৰত মহিলা আৰোগ্য সমিতিs হ'ব পাৰে senior citizen forums হ'ব পাৰে library committees হ'ব পাৰে farmers club হ'ব পাৰে mothers clubs হ'ব পাৰে so এই গোটেই গোটসমূহে actually actively তাৰপিছত they have started contributing sensitize কৰে advocate কৰে health camps কৰে presumptive cases যাৰ লক্ষণ বিলাক আছে those presumptive cases are referred to the health institutions. So there we can see that the dots are being connected. The lines are drawn between the dots. The bridges are being built between the field and the facility, between the community and the healthcare providers. So this is basically the scorecard of the KHPT so far. Amar a Tinikhon district does, of course, Baksa would have a population of 1 million. Dibrugarh will have around 14 lakhs, and Guwahati, Kamrup Metro has around 15 lakh of population. So instead of going to the whole population, this was basically a pilot. And what we did, we went to the most marginalized class, the urban slum dwellers, the rickshawalas, the rag pickers, those who do daily work, wage earning and all, the domestic workers, the transgenders even. And Baksa nami 1.5 lakh marginalized population lot kaam kori aso. In Dibrugarh it's 1.7 lakh, and in Kamrup it is 1.6 lakh. And out of those, if you see, 542 community structures are actively supporting the effort. Pray 7 lakh manuhok teoloke screen korise. Teoloke nije kono doctor nai de, kono asha ANM okol teolok nai, teoloke community structure ei mohila hokole এই পুৰুষ সকলে গৈ গৈ তেওঁলোকে সিম্পটমেটিক লক্ষণ বিলাক চাই পিনে স্ক্ৰিন কৰিছে আৰু স্ক্ৰিনৰ পাছত প্ৰায় 7,500 কেছক তেওঁলোকে ৰেফাৰ কৰিছে হস্পিটালত কি ভাইটি তুমি যোৱা দাদা তই যা তোৰ অলপ এই লক্ষণ বিলাক দেখোন এনেকুৱা হৈছে টিবি হ'ব পাৰে বা বেলেগ এটা বেমাৰ তই গৈ এবাৰ চাই আছোন কি হয় and out of those almost 3,500 have been tested and 518 have been diagnosed as positive. Community eta janaganor movement loa babe 518 people have been found to be positive. Now I tell about another statistic. A person if not detected or if he doesn't go for testing and if he has TB in a year's time he can affect 15 to 17 more people with TB. So just see look at the chain reaction. It is geometrical. Bahut speed of jabo. So it is very important, and it is the communities who have actually done all these things to support the government in identifying the people with TB and offering them help. So this is again like a kind of major achievements, whatever I have told. So this is the Assam's cascade, and not only that, people with TB, hospital who সম্পৰ্ক ৰাখিছো, and there also they come with their families, doctor থাকে, আন মানুহ থাকে, village head গৰাকী থাকে, or ward member গৰাকী থাকে, and together we try to identify the barriers and close the gaps. Next one. These are the potential and scale for application. Like it has been found like this community structure, the engagement and the behavioral change model can actually go a long way in infusing the spirit among the communities and motivating them to do better. Next one. The sustainability also it has been seen even after the project is gone, the people are gone, the government is gone, the community structures will be there. So sustainability is যদি কথা কওঁ দীৰ্ঘকালীন যদি তেওঁলোকৰ স্থায়িত্বৰ কথা কোৱা যায় তেওঁলোক সদায় থাকিব তাতে
স্যার ও পারেন না স্যার এটা কথা
হয় স্যার
ও পারেন না স্যার রেসপেক্টেড guests are ওরা মই কোয়াইটা খুব বিচাৰিছো যে চিবে সময়তে আপুনি কৈ আছে যে চিবিটো অলাসাবত এলিমিনেশন কৰিব লাগে বুলি কৈ আছে তো এইটোই মই চিন্তা কৰিছো এলিমিনেশন কেনেকৈ কৰিব মোস্টলি ট্ৰাইবেল এৰিয়াছ চিবি হোৱাৰ কাৰণে বংশনা কমেও হয় আৰু বংশনা কমেও নহয় কিন্তু ট্ৰাইবেলৰ মোস্টলি হোৱাটো মই নিজে চকুতে চাইছো যে মোস্টলি এই মদৰ পৰাই হৈ আছে মদ খোৱা অভ্যাস হয় মদ খোৱাৰ পিছত চিবি হোৱাটো মই দেখিছো মোৰ নিজৰ চকুতে তো মোৰ যদি আপোনালোকে ট্ৰাইবেল এৰিয়াৰ পৰা বা অসমৰ পৰা যদি এলিমিনেট কৰিব নোৱাৰে মদটো তেতিয়াহ'লে চিবিটো এলিমিনেট কৰিব নোৱাৰিব মোৰ অভিজ্ঞতা এইটো ক'ব বিচাৰিছো সেইকাৰণে চিবি এলিমিনেশ্যন কৰাৰ আগতে আপোনালোকে মদটো মানে এলিমিনেশ্যন কৰিব লাগিব নহ'লে চিবিটো এলিমিনেশ্যন কৰিব নোৱাৰিব যেনেকৈ চিবিটো এটা কি হয় বংশক্ৰমে হয় আৰু মদ খোৱাৰ পিছত বা ড্ৰাগছ খোৱাৰ পিছত চিবিটো হয় সেইকাৰণে এইটো মদ খোৱাটো আপোনালোকে মদটো ট্ৰাইবেল এৰিয়াৰ পৰা এইটো নাইকিয়া কৰিব লাগিব
Thank you, Dada. আপুনি বহুত এটা ইম্পৰ্টেণ্ট কথা কৈছে
ইনফেক্ট এইটোৱে মোৰ অনুৰোধ তাতকে ট্ৰাইবেলৰ পৰা যাতে মদটো এলিমিনেট কৰে
Surely, sir. So this has been also scientifically proved that alcoholism is one of the major constraints in TB. তেওঁলোকে কি কৰে গোটে আমি যদি এন্টিবায়োটিক খোৱা যায় there is a regime আৰু গোটে ৰেজিমটো বিনষ্ট হৈ যায় and alcoholism is one of the major causes of relapse and the misery caused to the TB patients. কিন্তু দাদা আপুনি যদি সেকেন্ড কথা ক'লে কি আপোনালোকে মদ শেষ কৰিব আপোনালোকে নহয় আমি সকলোৱে So that is why etu jonogonor eta procesta hoy ami heibabe community kam bila kori asu etia mane we cannot share responsibilities everybody's business is nobody's business so apnalok boli nohoy the me should turn into we right the you should also turn into us আমি সকলোৱে একেলগে কৰিব লাগিব বাট থ্যাংক ইউ সো মাচ এটো খুব ডাঙৰ আমি কথা কৈছে স্যাৰ আমি বাক্সা এখানে ভিসিডিসি ভিডিপি মানুহখিনিৰ লগত আৰু টি গাৰ্ডেন্স হ'ব তেখেতসকলৰ লগত কথা পাতি আছো এই ভিডিঅ' বিলাক দেখিলে এইখিনিটো আমাৰ ষ্টিগমাৰ ওপৰত আছিল ঠিক তেনেকৈ আমি এলকহলিজমৰ ওপৰত আমাৰ আগন্তুক কেইখনমান স্লাইড আছে মই আপোনালোকক দেখাম কি কি ধৰণৰ আমাৰ বিহেভিয়াৰ চেঞ্জ সলিউশনছ আছে য'ত সম্পূৰ্ণৰূপে নহলেও কিছু ওপৰত কিন্তু আমাক অলপ উৎসাহ জগাইছে নেক্সট ওয়ান প্লিজ এইটো যদি আপুনি দেখিছে these are all see these are all people in the villages তেওঁলোকে নিজে গৈ assessment কৰিছে তেওঁলোকে লক্ষণবিলাক চিনাক্ত কৰিছে তেওঁলোকে পঠাইছে য'ত মদ খাই আছে বিশেষকৈ টি গাৰ্ডেনত তেওঁলোকে মদৰ ঘাটি কিছুমান ধ্বংস কৰিছে মেনেজমেন্টৰ তাতে সাপোৰ্ট আছে ঠিক তেনেকৈ আমি ইয়াতো কৰিব লাগিব অকল মদে নহয় দাদা এতিয়া আমাৰ সাবষ্টেন্স এবিউজো আহিছে অলপ যুৱ প্ৰজন্মই কিছুমানে ড্ৰাগছটো লৈছে আসক্তিটো বাঢ়িছে তাতেও আমি কি ধৰণে কৰিব পাৰো সো এই ধৰণে আমি কামবিলাক কৰিব লাগিব
যেনেকৈ মেলেৰিয়াটো আমাৰ অসমৰ পৰা নাইকিয়া হৈ গ'ল এলিমিনেট কৰিব পাৰিলে কিন্তু চিবিটো নোৱাৰিব লাগে যদি মদ যদি নোৱাৰে তেতিয়া চিবিটো
Sir, এইটো অকল অসম বুলি নহয়, মই আপোনাক আৰু এটা statistic দিম. Elimination doesn't mean zero count. Elimination means presently our India the incidence of TB is 187 per lakh. 1 লাখত 187 গৰাকীৰ TB হৈ আছে বুলি ৰিপৰ্টে কয়. Now within 2025, in the next 2 years, this score has to come down to less than 44 per lakh. Per লাখত যদি 44 গৰাকী মানুহৰ টিবি থাকে তেতিয়া ইণ্ডিয়াৰ পৰা টিবি টো এলিমিনেট হোৱা বুলি ক'ব পাৰি. Then we will reach the first stage. গতিকে elimination, eradication is different. Elimination doesn't mean zero, but it is to bring down considerably the number from this stage to this stage. Thank you. Next one. So theory of change আমি কি কৰিছো দাদাই যোনটো কথা কৈছে at 4 levels আমি আমাৰ চেঞ্জ যোনখিনি ইঞ্জিনছ হয় সেইখিনি আমি ইমপ্লিমেন্ট কৰো at the individual or familial level, at the say the societal level, at the community level, and at the policy level. মানুহ গৰাকীয়ে মদ খাই আছে, সো আমি কি ধৰণৰ ডিফাৰেন্সিয়েল কেয়াৰ মডেল বুলি কয়, তেওঁ যদি আগতে বহুত খাইছিল আমি লগে লগে বন্ধ কৰিব নোৱাৰো, সো আমি যত্ন কৰোঁ কি can we put in some sanctions, অলপ তেওঁলোকক কমাব পাৰো নে প্ৰথম সেইটো চাওঁ. সো ঠিক তেনেকৈ কাৰোবাৰ যদি কোমৰবিডিটি আছে তেওঁৰ কেয়াৰ মডেলটো অলপ বেলেগ হৈ যায়, ঠিক তেনেকৈ আমি গৈ থাকো. ফ্যামিলি মেম্বাৰ্স খিনিৰো ডিপ্ৰেছন হয়, মেন্টাল হেলথ এনজাইটি থাকে, সো তেওঁলোককো আমি অলপ কেয়াৰ প্ৰভাইড কৰিব চেষ্টা কৰো. সিমিলাৰলি ভিলেজখন এতিয়া স্কুলৰ ষ্টুডেন্টস বিলাকে বাক্সাত কি কৰিছে তেওঁলোকে নিজৰ নিজৰ ঘৰত যায়, এখন এখন আমি শীট দিছো, they go to their homes, তেওঁলোকে লক্ষণবিলাকত চিনাক্ত কৰে আৰু ওচৰৰ চুবুৰীয়া দুই ঘৰতো যায়, তেওঁলোকে লক্ষণ যদি কিবা আছে চিনাক্ত কৰি স্কুলত টিচাৰক দি দিয়ে আৰু টিচাৰৰ পৰা আমাৰ বাইদেউসকলে আত্মসহায়ক গোটৰ বাইদেউসকলে তেওঁলোকে লৈ আহি পিনে আমাক দিয়ে, and basis the scores if someone needs to be referred, they are referred from these communities to the health institution. So behavior change, this is what is like, no, এখন referral slip দিছে এগৰাকী আমাৰ আত্মসহায়ক গোটৰ ভিউৰ মেম্বাৰ এগৰাকী আন মহিলা, তেওঁৰ হয়তো কিছুমান লক্ষণ আছে, she is presumptive with some signs and symptoms, so she has been given this referral slip. And this referral slip, generally if I am a common man, I might hesitate to go to the health institution because I do not know like how I will be treated. So a referral slip to poor lage there is a trust, there is a confidence ki oh, I will be better treated. My treatment will happen on fast track. So these are the kind of solutions we have been providing. Next one. So if we talk about our small kind of recent assessment has been, there are some behavioral contexts and there are some opportunities. For example, Boro Hamazot বা ভিলেজ বুলি কওঁ মই, তাতে আছে কি আন বেমাৰ বিলাক বেলেগ, টিবি টো বেলেগ কৈ ৰাখিব লাগিব. Now the opportunity is like if you can empower the caregivers, infuse them with the information, with the knowledge, then they can better and more confidently take care of the TB patient. Similarly, there are helpful people. Boro Hamazot to iman discipline hoy, and that sense of belongingness is so high, so strong that there is no question about not being helped. But there is a lack of knowledge about the health centers. Code a treatment bilak hoy, code a khub byabostha khini ase. So I think we can make them more sensitized and aware about these provisions. Language is a barrier sometimes. So ketiba ki hoy moi egoraki goya boro bakinda hoy, moi boro manu egoraki hoy, when I go and I talk, I share my things with the doctor may not be, or the other person may not be able to understand what I am saying, and this is vice versa. So that's why if you could see amar ekon man ami IEC ba eloka bonai asu jot ami boro satri okomia ei dhoroner bhasha to ami audio visuals kikoman bonai pine ami samajot ekini promote koribo bisarisu. Next one. So similarly tea gardens also tenekai hoy, but there are subtle differences. Yate teloke asha koraki বহুত important মানুহ বুলি ভাবে, and it is an opportunity for us to go and mobilize the asha better. Ketiba ki hoy people in the tea gardens, because there is a machinery above them, abe amar kiba hole okay, there are the management, the other people who will come and take care of us, but self management, self care, I think there is a scope for all of us to go and help them take good care of themselves. So these are kind of like behavior interpretations, behavior change models like which can be developed and piloted and promoted by the communities. Next one. So these are some of the engines of behavior change. প্রথম তো যদি চাই আপোনাৰ TB starter kit বুলি কওঁ. Whenever there is a TB patient identified, he is being invited to the hospital with his caregiver, and there is a doctor and there are the other people. He is being counseled. There is some kind of skepticism. There is some kind of anxiety because there will be some perhaps adverse effect of drugs the initial few days. Now all these things are taken care of. He is being properly attended, and as a result, he gains in confidence. নহলে কেতিয়াবা কি হয় 6 মাহৰ ঔষধ এমাহ খাই পিনে এৰি দিয়ে, and that is devastating. He might change into an MDR, a multiple drug resistant TB. So the starter kit basically helps in ensuring the treatment adherence and successful treatment outcome. Janch coupon juntu kolu, these are referral slips. Amar referral slip kune diya hospital diye, doctor e diye moi likhi disu tumi omukot joa. Kintu yate ki hoise amar সমাজৰ মহিলা এগৰাকীয়ে লিখি দিছে, পুৰুষ এগৰাকীয়ে লিখি দিছে. This slip, this person is referred by someone from the community. So this is enabling the community to take care of themselves, strengthening the referral pathway. There are not adequate doctors, there are not enough healthcare workers. It is here the community has started taking up the mental responsibility of helping the whole movement go as envisaged. Health auto কি হয় বহুতৰে আমাৰ পইচাৰ বাবে আমি যাব নোৱাৰো, ইমান দাম 100 টকা যাওঁতে যাব 100 টকা আহোতে যাব. So because of lack of money, many people do not go to the secondary institute for testing or even DMC. So health auto আমাৰ কি কৰো, our project bears all the cost. আমি গোটে খৰচাখিনি বহন কৰো, and these symptomatic cases, the presenting cases are being transported from their homes, from their households to the institutions, and we take care of all the budget, all the finance. So এনেকেও health auto মাধ্যমেৰেও বহুখিনি মানুহক আমি চিনাক্ত কৰিব পাৰিছো. TB book certificate is something because it is related to stigma. After the completion of the treatment, a doctor gives the certificate. So now this has become a kind of hit, and now the government in the recent workshop, it has been proposed from Assam this whole certificate should be digitized. Our governmental portal ote ahibo lage. Whenever a person completes the treatment, this should be flagged in the portal and the certificate should auto generate. So ei dhoroner ami digital India madhyamere kisuman kaam koribo bisarisu. TB Sushna is all about miking, awareness creation, mass awareness creation. So ei autophone apuni dekhise jagai jagai jay teonke mic bojai jay aru manukhiniye kobat hatot hok market place hok kobat public place hok yate gaon bilakot hok goi miking kore. TB champion as health worker. So more TB hoise moi eta survivor hoy, moi TB পৰাজিত কৰিছো, এটা মই সুস্থ জীৱন এটা জীয়াই আছো. গতিকে মোৰ দৰে আন মানুহখিনিকো আমি লৈ পিনে তেওঁলোকৰ মাধ্যমেৰে আমি টিবিৰ সজাগতা বিয়পোৱা যায়, হেল্থ সিকিং বিহেভিয়াৰ কৰোৱা যায়. And this also has been very very effective. Phone a friend. কেতিয়াবা মোৰ কি হয়, because I have some apprehensions, I have some hesitation, I have some anxiety, I do not want to disclose this to others. So I can easily call up someone and talk. There is a call center. So তাতে ধুনিয়াকে কাউন্সেলিংৰ পৰা আৰম্ভ কৰি গুটেখিনি সাৰ্ভিসেস দিবলৈ যত্ন কৰা হয়. Sharing circles is something for example আশা সকলে ইমান কষ্ট কৰে, তেওঁলোকৰো কেতিয়াবা মনত কিছুমান বিঘাত থাকে বা মনত কিছুমান আইডিয়াছ থাকে, কাৰ লগতনো তেওঁলোকে শেয়াৰ কৰিব. So this is a platform য'ত healthcare workers সকলক আমি এটা প্লেটফৰ্ম সাজি দিওঁ য'ত তেওঁলোকে নিজৰ চিন্তাধাৰাবিলাকৰ মতামতবিলাক আদান প্ৰদান কৰিব পাৰে. And through this process, some good concepts come out, and those can be translated into best practices. And TB buddy is a kind of best friend. More kunu nai, moi boy khai asu. So there is a willing volunteer who will come and who will say that I can be the buddy of this TB patient. Aru teo treatment or samoyso teo olop emotional, mental support kini agborai. Next one, please. So this is the statistic tamane keneke help korise jodi referral slip khonare kotha kau এই ৰেফাৰেল স্লিপখনে প্ৰায় ৬,০০০ মানুহক এতিয়ালৈ মানে আমি পঠোৱা গৈছে কমিউনিটিৰ পৰা আৰু প্ৰায় 50% মানুহে টেষ্ট কৰিছে আৰু তাৰে ভিতৰত প্ৰায় 15% মানুহৰ টিবি ডিটেক্ট হৈছে আমাৰ সমাজত টিবি আছে আৰু সমাজৰ মানুহখিনিয়ে কমিউনিটিয়ে যেতিয়া কাম কৰিব এনেকৈ গৈ গৈ আমি ঝাড়ু মাৰি পিনে যেনেকৈ ক্লিন কৰো স্ট্ৰিপ কৰোৱা যাব challenges mitigation there are some challenges there are mitigations which are being taken care of আৰু আমি উচিত মহলত এইখিনি কথা পতা যায় at the community level community representatives সকলক আমি TB forums বনোৱা হৈছে TB forums like no they are offered an opportunity to air their views in TB forums and the structural barriers the social barriers the cultural barriers the other barriers are being attended and taken care of these all of these are the expected outcomes outcomes ki hoy stigma kom hobo lage community ownership besi hobo lage ei dukhiya gorib manu khini jate gute khini bostu pai ekini sabo lage nutrition is a big factor তেওঁলোকে যাতে পুষ্টিকৰ খাদ্য পায় এটা গভর্নমেন্টে নিশ্চয় মিত্র বলি এটা উলাইছে where a TB patient can be adopted by anyone 6 মাহৰ কাৰণে তেওঁলোকক ল'ব পাৰে এমাহত 300-400 টকাৰ ৰাশন তেওঁলোকক দিব পাৰে গভর্নমেন্টক 500 টকা দি আছে প্লাস মানুহ হবলেও ৰাশন দিছে সো এই ধৰণে এই ভাগিদাৰী যোনটো কয় হিস্সেদাৰী যোনটো কয় হেতু বলুৱাব পাৰি নেক্সট ওয়ান so lastly this is again like no something done by the community so I wanted to show this to you this has come from the community agor jun kita video asil ekta those were made by some actors but these two videos are basically done by the communities so I will again invite you to these two videos to have these two videos
দুখন্তা হয় সপ্তাহ আৰু জল ওজন কমিছে আৰু নাযায় খাব মন জখমাৰো বৰ হ'ব পাৰে জানা এয়াও এক লক্ষ্য কলম নপৰি ভাই লৰালৰি কৰা চিকিৎসা অবিহনে নাই চিকিৎসা পাবা ভাই বিনামূলীয়া জখমাৰো বৰ পাবা সম্পূৰ্ণ সুৰক্ষা সরকারি চিকিৎসালয়ত আছে সকলো সুবিধা কোনো অসুবিধা চিকিৎসাৰ লগতে ভাল খাদ্য খালে জন্মৰো নিৰ্মূল হ'ব পাৰে
টিভিৰ কাৰণে আমি যিমান শক্তিশালী পদক্ষেপ লৈ আছো আমাৰ আশা আছে টিভি হাৰেগা দেশ জিতেগা
অসমত প্ৰতি বছৰে প্ৰায় 30,000 জন ৰোগী যক্ষ্মা ৰোগৰ পৰা আৰোগ্য হয় যক্ষ্মা হাৰিব দেশ জিকিব যিসকল লোকে আবাদ সেৱন কৰে তেওঁলোকৰ যক্ষ্মা হোৱাৰ সম্ভাৱনাটো অতি বেছি
চিকিৎসা সম্পূৰ্ণ কৰিলে যক্ষ্মাৰ পৰা আৰোগ্য সম্ভৱ যক্ষ্মা হাৰিব দেশ জিকিব
আমি সকলোৱে যক্ষ্মা ৰোগ নিৰ্মূল কৰোঁ যক্ষ্মা হাৰিব দেশ জিকিব মই এজন ক্ৰীড়াবিদ হিচাপে মই এই অভিযানত মোৰ সহযোগিতা আগবঢ়াম যক্ষ্মা হাৰিব দেশ জিকিব এজন সংবাদকৰ্মী হিচাপে ময়ো অংশীদাৰ হওঁ যক্ষ্মা হাৰিব দেশ জিকিব এজন শৰীৰ চৰ্চাবিদ হিচাপে মোৰো আচলতে চৰ্চাৰ প্ৰতি দায়িত্ব এটা আছে ময়ো সহযোগিতা আগবঢ়াই যাম যক্ষ্মা হাৰিব দেশ জিকিব
टीबी हारेगा देश जीतेगा टीबी हारेगा देश जीतेगा
নমস্কাৰ মোৰ নাম অৰ্জুন নাৰ্জাৰী মই বৰ্তমান বামুণগাঁৱত আছো মই আইডিঅলজিত চাকৰি কৰোঁ মোৰ টিবি অলপ ভাল হৈছিলোঁ ডক্টৰৰ পৰা ঔষধ খালোঁ ঔষধ বৰ্তমান এতিয়া মই সুস্থ হৈ আছোঁ মোৰ দেউতাই তাৰমানে সুস্থ হৈছিলে মই যথেষ্ট মানে যিমানখিনি পাৰোঁ সেইখিনি মানে সহায় কৰিছিলোঁ টিবি ৰিপৰ্টটো আছে অহাৰ পিছত মানে আমাৰ ঘৰৰ মানুহবিলাক চবে মানে অলপ ভয় ভাৱ আছিলে যে টিবিটো হ'লে মানে অলপ স্প্ৰেড হোৱা বোলে কম পোৱা যায় আমাৰ ইয়াত টিবি অহাৰ পিছত গাঁৱৰ মানুহবিলাক বহুত সজাগতা হৈছে আৰু এতিয়া বৰ্তমানলৈকে আমাৰ গাঁৱত মানে টিবি ৰোগবিলাক কমি গৈছে টিবি হোৱাৰ পাছত মই ঔষধ খালোঁ ঔষধ খাই ভাল পাইছোঁ বৰ্তমান আপোনালোকৰ নালাগে মই যেনেকৈ খাইছোঁ এনেকৈ আপোনালোকে খালে চিন্তা নকৰিব ভাল হৈ যাব
So Thank you so much. আপোনালোক সকলোৰে উৎসাহ দিয়াৰ বাবে আপোনালোকক বহুত বহুত ধন্যবাদ. May God bless you with good health and all happiness. Thank you so much. Thank you so much.
Thank you, Mr. Das, for your insightful talk on the various initiatives taken by your organization to promote health-seeking behavior. We have another session lined up right after this session, which is our session on Invite Talk, where we have 4 distinguished speakers who will be sharing their insights on the subject. We'll take a small 5-minute break before we start this session. Because this session has been going on since morning, we'll have a small 5-minute break. Right after that, we'll have our session, invited talk session. So we'll continue. आपका ज़्यादा से ज़्यादा खत्म हुआ 9 उसके बाद सालों तक